tracking 14 wellbeing metrics for quite a long time, and what we're beginning to find is these different areas, which are often approached in little pockets, are actually aligned. So the universal wellbeing model helps people to understand that we have social well-being, we have physical well-being, we have intellectual well-being, we have ethnic and cultural well-being, we have emotional well-being, and we have spiritual well-being. So when we start to really find answers, try to find answers to these entrenched poor well-being issues across Australian society, we start to see that in fact a lot of these challenges are interconnected. For example, a person who may be suicidal might also have suffered crime, or they might have been sexually assaulted or lived in a violent family. We might also find that they have an addiction, or that they don't own their own home, or they feel insecure in their own home. So when we start to really take out and look at the factors that are impacting people's well-being individually, we very quickly find there are multiple poor well-being metrics arranged. And in fact, in conversations with people running, for example, addiction facilities, they often tell a story of how people had increasing numbers of poor well-being metrics. Maybe they weren't sleeping, maybe they weren't getting on with their family, maybe there was a crime in the flat where they lived, maybe they got an illness or a disability. And as these factors started to accumulate, taking drugs seemed like a really good solution, a way to blot out these increasing challenges. This is a very, very common story. And so same with people, for example, who experience suicidal ideation, is that there are often accumulating numbers of poor well-being events that lead them to the state they move to. So in terms of reducing poor well-being in Australia, we cannot just play whack-a-mole and sort of try to fix their eating habits or their sleep. We need to look at the whole person. The Universal Wellbeing Evaluation Tools allows us to do a comprehensive and holistic survey of the metrics that we know lead to poor well-being. And so what we can do is we can identify what is actually happening for people. And it's never one thing. I have to say, it's never one thing. There might be one last straw that breaks the camel's back, but there are always a growing number of poor well-being impacts that lead to this poor well-being. And so in Australia, we are looking to support looking at well-being through a universal and evidence-based, comprehensive and holistic way, because we know this can help us to find solutions that are achievable, that are sustainable, and ultimately they're cost effective, because the impact of poor well-being, whether it's any of the factors I've talked about, is a high cost, not just for that person, but for their family or their workplace or wherever they study or live. So to actually get into and solve poor well-being challenges in Australia, we're going to have to broaden the lens and look at the whole picture and the whole person as opposed to parts of them.